Now from our medical expert, Dr. Arnold Baskies. Thanks for being here again, Dr. Baskies. Let's take another look at the president's comments on Twitter, first of all. He wrote in part, "Don't be afraid of COVID. Don't let it dominate your life. We've developed under the Trump administration some really great drugs and knowledge. I feel better than I did 20 years ago." So, Dr. Baskies, as a doctor, what do you think of that message from the president overall, and especially telling people not to be afraid of COVID?
Well, you know, it's an interesting message, but something that we've grown accustomed to from the president for sure. At the end of the day, there's only one person that knows how he's doing, and that's President that is on his way back to the White House in about 2 hours. The treatment for his COVID has been state of the art. There's no question about that, and he has received all of the experimental drugs that are available. The message that he's giving is unfortunately not the right message right now. The message that we should be giving to people is be careful, wear your mask, and social distance. But suffice to say, if the president does change his clinical status, and let's say, God forbid, it gets worse, I can guarantee you he can get back to Bethesda Naval a lot faster than most people can. Yeah. So I think the only people that really know how he's doing are the doctors that are taking care of him. Certainly none of us have a minute-to-minute comprehension of how he's done, except to say that he's afebrile, if that's true, and his oxygen saturation levels have not dropped again. So he's had a response to the treatments. There's no question about that. And let's hope that he continues to improve. And that's all we can say at this point.
As you're pointing out, there's a lot we still don't know about his actual condition. His doctors have given those updates. We know he's on several medications, and we now know he needed supplemental oxygen a couple of times, first at the White House and then at Walter Reed. Based on what we have been told, would you say it's normal for a coronavirus patient to be released from the hospital after just 3 nights there at this point during their treatment?
Well, I've seen that happen, sure. I mean, you got to remember, Jim, the majority of people who get COVID do get better. You know, all the focus is on the president of the United States right now, but he hopefully will fall into the group of people that do get better. And that's with or without the medications he's received. Don't forget, he's gotten the antibody cocktail, he's gotten remdesivir, and he's also currently on steroids, and he's going to continue on remdesivir, I think, for at least 1 or 2 more days to complete a 5-day cycle. So he's a poster child for the advances that we've made. 7 months ago, when we first had an outbreak, we really didn't have any idea how to treat this. And now we have a much better handle on it. So he is hopefully going to fall into that group that does get better. Does he have risk factors? Absolutely. And I think that's why they moved him to Bethesda Naval. That and the fact that his oxygen saturation dropped. He had a high fever, we came to find out. All of those factors. But the majority of people do get better. And he's had some very advanced drugs that are probably going to be in clinical use in the future on a routine basis for a lot of people.
All right, Dr. Arnold Baskies, thanks for your insights. We always appreciate you taking the time to talk with us.
Thanks.
Once again, President Trump is expected to leave Walter Reed Hospital around 6:30 tonight. Of course, we'll keep you updated on any other major developments on air and online.